In a related development, 32 victims of the recent Jigawa tank explosion recently receiving treatment at Amino Kano Teaching Hospital are responding well to medical care. Also, health authorities at the Federal Medical Center Nguru in Yobe State are working around the clock to provide care for victims of the tank explosion that killed more than 150 people. TVC News' Michael Oshoma and senior reporter Ibrahim Issa reports.
This is Federal Medical Center in Nguru local government area of Yobe State, where some of the injured victims of the Jigawa tanker explosion are currently receiving medical treatment. This is the emergency unit where the lives of some victims of fuel tanker explosions hangs on a thin thread. The bones on the survivors' bodies serve as a haunting reminder of the unimaginable horror and agony they endured. Yet, despite their traumatic experience, they consider themselves fortunate to be alive. Now, they pin their hope on the medical treatment they receive here, which promises a second chance at life. Fatima Musa, the mother of one of the survivors, was overcome with emotion as tears streamed down her face. Among the 35 survivors brought to this healthcare facility, 4 are children between the ages of 10 to 13 years. Sadly, 2 children in the same age group were among 6 confirmed dead by FMC medical officials. The healthcare workers spoke with TVC News. They are devastated by the loss of lives, but working hard to save more lives.
So we were informed that there are many on their way. So we understand that seeing the gravity of the burns, we have to devise a strategies, mobilize doctors as well as the nurses and the attendants and volunteers. So we evacuated the normal accident emergency patients to other wards, preparing a venue and place to receive those explosion victims.
We have overstressed our resources. We have to call for external help, and even we are still on it. Like, since they have brought all the patients since yesterday, we have to find a way of create space out of unavailability of space. We've all been on our tools since yesterday, and even to get time to rest has been very difficult.
We were told that many of them were unable to open their eyes when they were rushed into the facility last night. But now they are responding to treatment. As the survivors continue their gradual recovery, medical staff remain optimistic for a successful rehabilitation and discharge. Michael Oshoma, TVC News, Nguru, Yobe State.